Hi everyone, Dr. Kristen and Dr. Dalton here today. We want to talk to you about sciatica. So first and foremost, sciatica is merely a symptom. It is not a diagnosis. So sciatica is, the symptom in and of itself is pain down the back of the leg. So it can be starting from the lower back, go down the back side of the leg all the way to the foot. So that is sciatica, and it's merely irritation of the specific sciatic nerve. So there are different causes to why you may be feeling this symptom. The first one being, coming from the lower back where that nerve initially comes out of the spine. So things like a disc bulge, disc herniation can cause irritation to that nerve, giving you that pain down the leg. Other areas that could cause these symptoms are your piriformis, so it's that muscle in the glutes, and that can get really, really tight and cause irritation, giving you those sciatica symptoms. And the third way that you could get those symptoms is from nerve adhesions or any adhesions along the path of the nerve that can cause that irritation and lead you to those symptoms. So what we do, we have a lot of patients that come into us, and they're like, Doc, I got the sciatica, I got pain down the leg, and they're pointing to the front of the leg. First and foremost, that's not sciatica. Second of all, you do not have the sciatica, you have an irritated sciatic nerve, period.
So first and foremost, the ultimate goal is to figure out where the irritation is coming from. We have to do an examination, some movement screens, some tests to kind of rule in or rule out, is it truly a disc herniation, or is it truly just coming from muscular tightness or adhesions or anything along those lines? So that's where you need a good therapist, someone that will do the examination, the movement screens, the tests, to really kind of rule in or rule out where this irritation is coming from.
So depending on where or why you're experiencing these symptoms is going to depend on what treatment's going to work best for you. So not all treatments are going to work the same for each individual person, because everybody's made differently and their symptoms are coming from different areas. So once we figure out, where or why you're having these symptoms, we're going to go through things that you can do to fix your symptoms specifically. So we're going to go over some of the different exercises and stretches you can do. Like I said, not every one of these is going to work for every person. So that is why it's also important to get to a physician and figure out, where it's coming from, so you can get specific treatment for you. But we're just going to go over some of the specific exercises and stretches that will help you, whether you're having these symptoms because it's coming from the lower back, from your piriformis muscle, or from adhesions along the nerve. So give these a try and let us know what you think.
So typically, if this is a true disc herniation or a disc bulge, if it's creating that static type pain, then we're going to have what they call a directional preference. So we're going to have a direction of movement that disc or that bulge or that herniation will respond to relieve some of that pressure and that pain down the legs. So the first one we're going to do is just a simple, what they call McKenzie extension, press up. So you're going to put your arms beside you. All right, so what you're going to do is you're going to tuck in your elbows to the side, hands flat. So what I typically like to start with, just kind of ease people into it, or just kind of create like a baseline, is I tell people just do a Sphinx. So if they want to come up onto their elbows, they can. Kind of sit here for a couple seconds, see what this changes anything down the legs. Now typically we're going to see either what they call centralization, where the pain or the sciatic type pain down the leg starts kind of creeping back up the leg, or we're going to have peripheralization, where the pain starts going further down the legs. And that will typically be indicative of we're in the wrong direction. So we like to see that pain kind of creeping back up the leg, back towards the spine. And if we start to see that, then we know that we're kind of giving the position of that disc what it wants. So go back down. So we're going to kind of progress to the next level here. And what I typically like to do is just hands flat. And you're going to try to keep the front of your pelvis or the front of your belly on the floor. And you're just going to push straight up, lift the chest up. Good. Now this is kind of, like I said, a progression move from that Sphinx position or sitting on your elbows. And again, we should start to see kind of that sciatic type pain creeping back up the leg. And if we're not seeing it creep up the leg, then maybe we're in the wrong directional preference here. So back down. Perfect. And one more. Yep, so keeping the hips flat on the table, we're gonna press straight up, and you can just tell it puts a lot of extension through this low back right here. Okay, back down. Good. So typically for this exercise, we will see that repetition is good. We typically don't like that kind of just holding that position for a while. So you're gonna feel maybe a little discomfort in the low back itself doing these exercises. That's why we like to do the repetition. So, do about 4 or 5 of these, just kind of holding it for about 3 seconds at the top. And then what that's gonna do is you're gonna kind of see, it's either gonna improve the symptoms down the legs, or it's gonna stay the same, or it's gonna get worse. So if it tends to improve or stay the same, we like to keep going. Maybe we just need a little bit more of the repetitions. And if it tends to get worse, like I said, then we know to stop doing it. We're putting you in the wrong position. So what we're gonna work on here now is, instead of doing the focused on kind of like the disc herniation type exercises, we're gonna work on the piriformis stretches. So 2 simple stretches that we like to do in our office to kind of alleviate that discomfort into the hips and loosen up some of those muscles. You're gonna pretty much start in the same position for both of them. So cross the leg over the other one. Yep. You're gonna put one hand right kind of on the ankle, one on the knee. You're gonna sit nice and tall. And then from there, I want you to lean forward at the hips. Now, what you should feel is kind of some stretch, some discomfort, like a hurt so good kind of thing in this upper hip. Okay, so lean back. All right, let's do one more. Sit nice and tall, lean forward.
So the key to this one is sitting up nice and tall, because you don't want to be bending at the lower back. It's not good for your lower back. So you want to sit up nice and tall, keep that lumbar spine straight, and then bending just at the hip so that you can open up that hip joint and then stretch those muscles as well.
Now, you may even have symptoms coming down the legs in this as well. Now, if so, I typically like to see that if we are having that pain down the legs when you do this stretch, it might be a little bit more in this hip than it would be in like the low back, for example. So it's a good stretch. Now, the second one we do is both hands will hold the knee. You're gonna sit nice and tall, and then you're gonna pull this knee towards the opposite shoulder. Now, same thing. We want the back nice and tall, protecting that low back, but at the same time, we're doing a nice stretch on that hip. And she'll probably tell you it feels pretty good.
Yeah, it's like it hurts so good. But the different variations could be whether you already have underlying hip impingement. Your hip might not like this one so much compared to this one. It opens up the hip a little bit more. This one we're stretching, but we're also feeling, if you have some hip issues, you're gonna feel a little bit of pinching in that front of the hip. So give those 2 a try and see how those feel. All right, so the last thing we want to show you guys is called a nerve floss. So this is just really good for any irritation. So what we're gonna do is, the nerve floss is exactly what it sounds like. Just like you floss your teeth, you want to floss that nerve. So what you're doing is you're taking that nerve, and we are putting tension in the nerve and then relaxing it, and tension and relaxing. So what that does is it glides that nerve through all the muscles, the joints, and everything that could be irritating it and entrapping that nerve, giving you that symptom. So this is a good exercise to do if you're feeling any kind of nerve pain, especially the sciatic pain down the leg. So what I'm gonna have Dalton do is I'm gonna have him, you're gonna start sitting, and then what you're gonna do is, depending on what leg is affected, that's gonna be the leg that we're gonna move. So let's say it's his right leg. So what we're gonna have you do is we're gonna have you keep that ankle nice and flexed, and then as he straightens this leg, so you're gonna straighten the leg, and then you're gonna look up. Good, and then you're going to bring the foot down, and then look down towards the foot. So what we want from this stretch is we want repetition. So the more you do it, the more that we are gliding that nerve and freeing it of any adhesions throughout the entire path. So the more you do it, the easier it might get, and you might see those symptoms decrease a little bit more. So this is good no matter where you're getting those symptoms from, because it's just moving that nerve and gliding it back and forth.
All right, guys, so that was a couple exercises and stretches that we like to utilize in the office. Now, typically, we would kind of get into those after we've gone through the exam. We've kind of really determined what's causing your sciatic type pain. So
give those a try. What you'll notice is Some might give you relief more than the others, but some might not give you relief at all. So if that is you, if you are feeling any type sciatic pain down the leg, it's very, very important that you find a provider that you can go to, get a proper evaluation examination, because honestly and truly, your symptoms are not going to improve unless you have the right diagnosis and the right treatment. So it's definitely important to find out, where and why your symptoms are happening so that you can get the proper treatment and really, say goodbye to those symptoms for once and for all. So give those a try, but ultimately reach out to us if you're local. We would love to get you in the office, get you evaluated and examined, or reach out regardless. We know people everywhere. So if you have any questions about sciatica, please feel free to reach out. We hope you enjoyed it.